once again welcome to my Oet channel. Today I came with one crucial role play card. So by this role play card itself you can see that it is very much difficult to present, because you can see that there are many subtasks and the time will be difficult to manage. So anyway, we will see how to do the presentation, as well as it is another one more important thing. This is a second degree role play card, and you are talking to the patient's son or daughter, and this is happening in hospital outpatient clinic. Patient has undergone the surgery, as well as she has dementia, so many things are there, but you are talking regarding the post-operative home care. Anyway, we will see the scenario. So first you have to see the setting. It is a hospital outpatient clinic, and you see the son or daughter and main carer of a 75 years old woman. His or her mother has dementia and has recently had a cholecystectomy surgery to remove the gallbladder, and is now being discharged, but you are not in the ward, you are in the clinic. You are discussing the aftercare that is required. His or her mother is not present. So the important thing you have to note it here, mother is not present during the conversation, so it is out of ward. So you have to find out mother's name, as well as the son or daughter's name. So first thing is the confirm. The first task is confirm reason for son or daughter's appointment, information about mother's aftercare and post-discharge. Second task is find out about mother's living arrangement. So there are two tasks. So how we can start here, and it is outpatient clinic, so of course you have to start with your self introduction. It is not a known scenario, so you can start like this. Good morning, my name is Rashmi Rajan, one of the registered nurses working in this hospital outpatient clinic. How may I address you and how can you help you today? Then the son will give you the answer. Good morning, sister, my name is Peter, and actually I came here to get some information regarding my mother's aftercare at home. Then for the confirmation we have to get the name. You can tell like this. Okay, Mr. Peter, I'm glad to give you information, but before proceeding further, may I know your mother's name? Then she will give you the name is Maria. We can tell that. From my system, I can see that recently she has undergone cholecystectomy surgery and she has dementia, isn't it? And you are here to get some information regarding her post-discharge information. Am I correct? Like that we can ask. Then the next point is find out about mother's living arrangement. Then we can ask like this. For my better understanding, Mr. Peter, could you please explain me how is your mother's living arrangement? Then the son's explanation is, actually she lives alone in her apartment, but now after surgery I will get her to my home because nobody is there to take care of her. Then we can tell that, oh well, I'm appreciating your willingness to get your mother to take care at home, and I would like to explain you the benefits of living with a family, because it will give her the practical and emotional support. Moreover, she can interact socially if she is in your home, isn't it? Then explore the next question is explore son or daughter's view of mother's recovery so far regarding physical strength, energy and mood. So this is one question. Explore means you have to ask some question. You can ask, Mr. Peter, I would like to ask you, according to your view, how is your mother's recovery so far regarding the physical strength, energy and the mood? Then the son will give you the answer. Sister, actually I can see that her physical strength, energy, mood, everything is low, so I expect 2 more days of hospitalization. Then we can tell that, yes, I can truly understand your concern, but according to the case note, I can tell you that according to the age, the recovery process will be delayed. For some patients, it can be, some patients require some more extended days, that means extended days for hospitalization. But for your mother, she has no infection, and she has improved her appetite, and there are only minor discomfort she has right now. Therefore, your mother's doctor has decided her to discharge at home. Are you getting my point? Like that we can ask. Then the next task is explain mother's wound care, like cleaning daily, keeping covered, soluble stitches disappear in 2 to 3 weeks, outline medication, oral antibiotics for 5 days, pain relief as required. Then laxative twice daily unless stool is loose, and describe restrictions also, no lifting, gentle exercise, small frequent meals, like that. So This is a large task. You have to explain many things. So how we can present? Now we can tell that. Well, Mr. Peter, thank you for your answering. Now I will explain you regarding her wound care at home. May I proceed with that? Don't ask shall I proceed. Always use the term may I. Okay, this is polite word. We can tell that, and don't tell that she has to do, you have to give, you need to give. No, you should not use these things and all. This is like a demanding word. What you can do, you can use please, or it is advisable for her, it is essential for her, it is important for her, like that. You can remember the recommendation paragraph of your OET letter. So how we can present? It is essential for your mother to clean her wound daily, as well as keep her wound covered. And regarding her stitches, which will disappear in 2 to 3 weeks. And regarding her medication, please provide her oral antibiotics for 5 days for pain relief as required as per the prescription. And there will be laxative twice daily unless her stool is loose. So these are all the medications which will be provided with you during her discharge today. And another one more thing I would like to stress, I would like to explain you regarding some restrictions. That means please try to avoid heavy lifting, lifting or any strenuous activities by herself. So please have a look on her. Moreover, I can tell you that, but she can do gentle exercises, as well as please provide her small and frequent meals. How does that sound? Like that we can ask, or else you can just split it into two. Then you can explain regarding her medication completely. Then you can ask, are you getting my point? Then next thing you can explain regarding her restrictions. Like that also you can explain. Then at last we can ask, are you getting my point, or is it clear with me, Peter? Then the son's answer will be, sister, I can understand everything, but I don't know whether I will forget everything after going home. Then we can tell your question is really reasonable, but no need to worry, Mr. Peter. Upon her discharge, we will provide you post-discharge information. So it is known as discharge pack, in which every information has been provided in detail. So you will not get any confusion even regarding her medications, which will be written very clearly, and regarding her restrictions, exercises, everything will be there, even the follow-up appointment also. So how does that sound? Like that we can ask. Another one more task is there, outline further support available, like community nurse, mothers, doctor, etc. So we can tell like that. Mr. Peter, I would like to explain you another one more important thing. During home stay, if you need anything for her, if she develops any complications, or if you need any assistance for her, of course you can contact with your mother's doctor or community nurse. So they will come and they will provide you the adequate information regarding your mother's care. So are you okay with that? Like that we can ask. Then the conclusion will be, I hope I have clarified all your doubts. Do you have any more clarifications to be answered? Then if there is no more questions, we can conclude. Okay, Mr. Peter, thank you for your here we can tell that thank you for accepting all my advices for your mother. I hope if you follow all my advices, your mother will get well. Very soon she will get a speedy recovery. And meanwhile, if you need any assistance or if you need any help, please do not hesitate to contact with us. This is our contact number. Thank you. That's enough. Or else you can just tell that I wish her speedy recovery. Many students used to tell that I wish you a speedy recovery for your mother. No need actually. This is like indirect way we are wishing. No need. You can just simple way you can tell that I wish her speedy recovery. That's enough. So I hope it is clear for you. So in such scenarios, one thing, it is very large topic. Another one thing, you are talking to a bystander. I mean to the son or daughter. So it's a second degree talk. Everywhere, keep it in your mind to use she. This is female mother. It is mother. So gender change should not be there, and name changes also should not be there, because they will reduce your mark. So take care when you are speaking to a second person. Always try to write to the listener's name in big letters, and patient's name you can write in a small letter, because you will use patient's name only once or twice, but you will use the listener name many times. So you can do like that so that you can avoid the mistake during the conversation. I hope this is beneficial for you. With another one informative video, we will meet again. Until then, bye. Take care.